Hello everyone, welcome to our channel. I'm Dr. Hu from South America. In this video, we're going to talk about one very interesting topic regarding Chinese medicine and society. If you have learned Chinese medicine or you have watched some of my videos, you will know that I always emphasize this: Chinese medicine or acupuncture. When we treat the patients, when we see patients, we not only focus on individuals, we focus on the patient themselves, we focus on the environment in terms of both the nature and the society. So in this video, we're going to use an example, a recent example, very popular topic, to explain the laws we use in Chinese medicine and the laws in a society. What's the similarities in between each other? So as we know, this Chinese medicine, there's an old saying that the top level doctor, who was the best one, the best doctor, he's not treating the patients. The best doctor is treating the countries. So we said that the top doctor is treating the country, which means the top doctor, they can use the law in Chinese medicine to treat, to manage, can use this law for the management of the country. So before we start, we're going to use the recent example, the COVID-19. COVID-19, now probably yesterday I searched on Google statistics, it reached more than 1.7 million globally. As we know, that's the COVID-19. Initially, we don't know where exactly it comes from, but where it become pandemic, it affects a lot of people. There's no doubt it is in China. It was in China, in Wuhan city. So in that city, I got a few dates here. According to the papers, the first case was reported in the 1st of December 2019. So, but at that time, we don't realize that COVID-19 is human transmitted. So until the 20th of January, the Chinese government, they confirms that COVID-19 is human transmitted on the 20th of January. A few days afterwards, on the 23rd of January, Wuhan city was locked down. So in 3 days, Wuhan city was locked down. And actually, if you know the Chinese culture, you will know that actually it's in the period of our New Year. The Chinese New Year is one of the most important festivals for us, and it's also very important for the economic. There's one news reported that during the New Year, the transportation, how many times they have moved people from here and there. In one festival, in one Chinese New Year, the people on the move was 3 billion times. 3 billion times. So they move people from here and there, 3 billion times in one festival. So you can see actually this festival, how important for the cultural, also how important for the economic for the country. But this year, because of the COVID-19, the city was locked down. The whole country was locked down in a few days. And a few days ago, on the 9th of April, Wuhan was reopened. So because from the statistics, from the cases, the COVID-19 cases in Wuhan, in the whole China, it's under control. So Wuhan city was reopened again. So here we're going to discuss the laws behind this phenomenon. The COVID-19 is human transmitted, and it's going to have great influence on the economic, on human health as well. But in a few days, the government decided to lock down the city, even the country. That's the theories in Chinese medicine. In Chinese medicine, we have the theories of treating the manifestations and treating the root causes. So when to treat the manifestations, when to treat the roots. That's the theories in Chinese medicine. In acute stage, in life-threatening stage, for these kind of diseases, we're going to treat the manifestations directly. You need to reduce, you need to eliminate the manifestation directly, and then you're going to treat the root causes to prevent it happen again. To treat the manifestation, especially in the acute stage, for the emergency, we need to decide very quick. That's also similar to the theories we talked about in the previous video of the military science, speed. When you're fighting with the enemies, speed is very important. You need to take very quick speed to decide what to do, how to prevent, how to treat. That's also exactly why for the many Western countries, many Euro countries, even the USA, they wasted 1 to 2 months, and now become disasters for them. In the fight, in the war between our health and the virus, speed, need to decide what to do immediately. Don't worry, we actually can't wait, because as we wait, the enemy becomes stronger. It's going to affect our health. That's the law, that's the theories we use in Chinese medicine when treating patients. For acute stage, we're going to treat the manifestation. In the acute stage, in the emergency, we're going to treat the manifestation. We're going to save the life immediately, no matter what's the root cause. So this is very similar. In the outbreak of COVID-19, the government locked down the city, locked down the country immediately for the manifestation, for the symptoms, to avoid further transmission between humans. So that's the manifestation. Now how about the roots? The root causes. What's the root causes, or what's the root solution for this kinds of diseases, such as COVID-19? There's a very similar example. It might be not accurate, but we can use as an example the vaccine. Vaccine might be the final solution for this kind of pandemic, because the vaccine can help people to immune from being infected. So this is the root solution. But as we can see from the science, for the manufacturing of a vaccine, it takes time. It's not something going to happen in a few weeks, even a few months. Because the clinical trials, it takes time. No matter how severe, how urgent this problem is, It takes time for the clinical trial. You need to vaccine on a group of people, and then you wait for a few weeks, a few months, and you get feedback from them, and that's the clinical trials. It takes time. So for this kinds of diseases, the manifestations, the root solution for how to deal with this kinds of pandemic. The first is to treat the manifestation. Then, in the meantime, we need to find out the solution for the root causes, for the root solutions. That's why, as you can see from the protocols in China, what they do, they lock down the city, lock down the countries immediately in a few days. And then, in the meantime, the scientists, they do the research on the vaccine. That's also in the same process. That's very similar when we see a patient. We treat the manifestations and then we treat the root causes. Sometimes we combine together. Also from the date, I gave you actually 3 dates. 20th of January, it was confirmed that COVID-19 was human transmitted. And 23rd of January, the city was locked down. So in 3 days, the city was locked down. And then on the 9th of April, a few days ago, Wuhan was reopened. The city was locked down first, reopened now. But actually, when you see from the cases, the statistics from Wuhan city, they still have about 2,000 patients there. So in the Wuhan city, it was locked down first, and it got very significant improvements, preventions for the further damage on human health. But now, a few days ago, the city was opened again. Before all patients recover from COVID-19, or before the cases go down to 0, why they open the city now? Is there any similar situation we can think from Chinese medicine? In 黄帝内经, it describes us if we use toxic herbs to treat the diseases, we're going to treat half, 50%. So if the patient recovers 50%, we will stop the toxic herbs. If we use mild toxic herbs, so it's not that toxic, it's mild, we're going to treat until the patient recovers 80%, 90%, and then we stop the herbs. We stop the treatments, we change the formula to non-toxic. If we use non-toxic herbs, non-toxic medicine to treat the patient, we're going to treat the patient until they recover about 90%. You can see from here, 50%, 70%, 80%, 90%. In 黄帝内经, it never tells us we need to treat the patient until 100% recovered. The reason why? That's because if we use non-toxic herbs to treat the patient, and the patient recovers from 90%, there's still 10% left. 10% of the discomfort of the disease is left. What are we going to do then? We're going to suggest the patient to work on their diet, to work on their lifestyle. They're going to benefit the 10% from there, and then this will be much easier for them to adjust back to their daily life, back to their normal life. That's exactly similar why the Wuhan city was opened again a few days ago. Because if you stop you lock down the city, you lock down the country, everyone knows now, even in South Africa, what this lockdown means to the people. What does this lockdown mean to the economic? It's going to greatly affect the economic, reduce the GDP as well. So if the diseases were controlled to a certain level, we need to open the city again, we need to open the country again to improve the economic, to reduce the damage in terms of economic to the country. So this is very similar theories we use in our treatments. We don't treat until 100% recovers and then ask the patient to go back to work. We will treat the patients until 80%, 90%, and then we will ask the patient to adjust their diet, to adjust their lifestyle, to work on these aspects, and then they also can benefit there. They need to go back to their normal daily life. So this is one of the examples to use the Chinese medicine theories to apply to the society. That's also why you see all these theories, these laws are all related to each other, from the nature, from the society, from human health. That's also why when we treat the patients, we always think about all these aspects. Because in these different periods of time, the patient may be different, the emotion may be different, the anxiety may be different. These are related to the nature and also related to the society. COVID-19 is something that's happening now, and it's actually a very good example for us to learn from there, to get a deeper understanding on Chinese medicine theories, the relationship between Chinese medicine theories and the society. Thank you for watching our video today. For more information, you can visit our website. See you next time.